So bronchial thermoplasty is a fascinating procedure. Asthma, and that's what thermoplasty treats. Asthma is a disorder where the smooth muscle that wraps around your breathing tubes contracts and basically causes your breathing tubes to shrink down. You don't have to be a doctor to know it's easier to breathe through this than this. The medications that people take, all the various inhalers, are designed to help open those air passages up, make it easier to breathe, give you less attacks, make it to where you're not in the emergency room, calling your doctor, being on steroids, etc., etc. Asthma carries a huge burden. Now, thankfully, a majority of asthmatics respond very well to all the inhaled medications, and the disease actually is easy to control and is a background annoyance, if you will, part of their life, but doesn't disrupt their life. And so they take their prescribed medications and they do great. There is a subset of asthmatics, though, that despite being on the correct therapy and doing it correctly, actually taking them, still have a lot of difficulty with their disease, that their disease still disrupts bulk of their life, that they spend too many nights in an emergency room, that they're taking another burst of steroids, missing work, etc. That's where bronchial thermoplasty comes in. This is a whole new approach to how to manage asthma. These people still maintain their inhalers. They absolutely are going to continue on their normal medications for however long that their doctor says you need to be on them. But because that muscle that contracts down the airways and makes it small, if you could actually stop that from contracting and almost if you could actually destroy it, then your airways would actually stay open. They wouldn't have the ability to shrink down. So thermoplasty is fascinating because we go in with a bronchoscope. So we put you to sleep. We go in with a tube with a camera on the end and put a little catheter out. And the catheter deploys and touches the walls of your breathing tubes and actually applies heat or energy that then turns into heat. And literally as the temperature rises, that smooth muscle becomes dysfunctional and ultimately destroyed. And thankfully, the remaining regions of the lung and the breathing tubes are actually not damaged by this. And this was all obviously proven through a series of clinical trials, and it was FDA approved based on the fact that this procedure actually does improve people's asthma symptom scores and lowers ER visits, things like that. Real tangible benefits to an asthmatic. It's not a cure for asthma. You're going to definitively still be on your inhalers. You may still have attacks, still potentially not go back to a completely normal life. But what the studies did show is that the amount of disruption that asthma has in your existence definitely shrinks. And so for some patients, it's a fantastic option. It's also not available at a lot of places, so it's very unique to the University of Chicago. It's done through 3 separate procedures. Because each one takes roughly 20 to 30 minutes. So we do one region of one lung, another region of another lung, and on the third one we get both upper regions of both lungs at the same time. And then that finishes the whole program. It's done under what's called conscious sedation. So you're given a bunch of medications that put you off into la-la land, or dream-like state. Very similar if someone's ever had a colonoscopy or an upper endoscopy. A bronchoscope is it's a scope for the lungs, but it's the same idea as those other scopes that go into other places. Ours is made for the lungs. We give you a set of drugs that you don't care, and you're off in la-la land. And you wake up, you go to recovery for about an hour and a half to 2 hours, and you go home. And then that's it. You won't need it again. For the first couple of weeks afterwards, you definitely have slightly more difficulty breathing. It definitely disrupts or it aggravates your asthma. Again, if asthma means that your airways are reactive, we go in and apply heat to them. You can imagine they're not that happy with us. So your asthma gets a little bit aggravated for a couple of days. What the studies definitely showed was after the third and final procedure, about 2 weeks after that, essentially as you've kind of re-healed, that's where all the benefits start to kick in. That's where we start to see people doing better and having better quality of lives and things like that.